So what makes our pediatric pulmonary fellowship so unique is really how personalized the fellowship can be. They're able to participate in educational opportunities a lot more easily. And we can tailor the fellowship to really achieve the goals that the individual fellow needs. The first year is predominantly clinical, but it allows the fellow to experience a lot of time with the different attendings. It allows them to slide back and forth between different teams such as cystic fibrosis, sleep, technology dependence, and that lets them sort of pick an area that they are interested in. The ultimate goal of research is to prepare you for your professional career after fellowship. And so once they identify an area that they're interested in, then we provide opportunities, extra time with that specific attending. We encourage a longitudinal research project that the fellow is the main principal investigator for. We also offer flexibility that the fellow can jump on an existing project. Our Pediatric Pulmonary Fellowship here at Nemours has a tremendous reputation. We have a significant presence at the international conferences such as the American Thoracic Society, and so that expands the fellows' experience as well as expands the reputation of Nemours. We see kids from all over the world who come here for procedures, for ongoing care, and not only do we function as a consultant to the families and take care of the patients, we also function as consultants to their local teams that may be thousands of miles away. You have to see and do a lot. The experiential learning in medicine is key. And I think being part of a tertiary hospital like Alfred I. DuPont Hospital for Children is key because we see and do a lot. We take care of critically sick children. We're the only children's hospital in Delaware. We have a tri-state or even 4-state referral base, including Pennsylvania, Maryland, New Jersey, and Delaware. So that provides the clinical and experiential basis. And our fellows are a key part of that, both in the outpatient as well as the inpatient setting. The second thing that's key is to have the autonomy to run the service and practice being an attending. And we often have fellows, sometimes during their first year, but especially during their second and third year, where they're running the inpatient service. And then the last thing is you have to have time to read. You have to have time to study. You have to have time to solidify the knowledge that you're getting from that experiential learning. When I think of what the perfect candidate for our fellowship is, I feel like our fellowship is flexible enough to cater, and any candidate has the potential to do well. But when I think about the person who can really take advantage of the opportunities that we have, I think about the fact that we have 7, where our 8th pulmonologist is joining us this month, and we have a tremendously busy clinical practice. For the fellow that has a little more autonomy and a little more initiative to go seek out those learning opportunities, they can really excel and have a tremendous background by the time they're putting their CV together and starting to focus on their professional career after fellowship. Thank you for your interest in the Nemours Pediatric Pulmonary Fellowship. I think you've made a tremendous decision to go into this specialty. I have loved every day that I have been doing this. I think that when you come here, and hopefully during our virtual interviews, you'll get an experience that gives a flavor of what our program is, and hopefully you'll be able to sense how much the team here is supportive of each other, flexible in supporting the fellowship, and we really look forward to your time here. Thank you so much for your interest.